You are now ready to begin the resting test. The resting test is designed to get an initial reading on the patient in the resting position. It takes the pressure of the anal sphincter muscles at rest, at the posterior, anterior, left and right locations. The graphic displays the posterior, the left, the anterior, and the right. The graphic shows the individual balloon's position as they relate to the patient. Step-by-step directions are located at the top of the screen. Begin the resting test by telling the patient to relax, and you need to enter the catheter position and tap Run and pause. The catheter position is located down on the bottom of the screen. Tap Location, start at 0, and you can select locations 1, 2, 3, 4, or 5. The graphic next to the numbers displays the depth of the catheter insertion. Warning indicators are at location 3, 4, and 5, because at that point you are generally past the standard anatomy of a patient, and the catheter position would extend into the rectum. For this example, we'll select location 0, which is just inside the anal verge. Tap the catheter position and verify that it's at 0. Tap the Run button in the lower part of the screen, and this will begin the test. On this test, a standard 20-second countdown will be displayed. You'll see a countdown clock at the bottom of the screen. There is also a pause button or a restart button that you can use at any time to stop or start the test. After 20 seconds, the resting test will automatically send you to the next test, which is called the squeeze test. If for any reason you need to redo a resting test, you can simply tap the resting icon and restart. You will need to select the catheter position again and then redo the resting test. The purpose of the resting test is to get a baseline reading of the posterior, anterior, left, and right functions of the patient. The next test is called the squeeze test. As the name suggests, the patient is instructed to squeeze, as if holding in a bowel movement. Readings will be taken from the posterior, left, anterior, and right positions. Confirm the catheter position by tapping the catheter button again. In this example, we are still at position 0 on the patient, so tap that button. You will see a 5-second delay before the Run button comes up. The 5-second delay allows the mcompass to take an initial reading before the patient begins their squeeze. Each squeeze should last for 20 seconds, and then there is a 1-minute wait between each squeeze. The system is capable of handling up to 5 different squeeze tests at each catheter position. Most patients will do 1 to 3. When the patient is ready, tap the Run button. Then instruct the patient to squeeze. Pressure is being applied to the balloons by their squeeze. Encourage the patient to continuously squeeze as long as they can through the 20-second countdown. Once the countdown hits 0, instruct the patient to stop squeezing and relax. The standard protocol says to wait 1 minute between squeezes. If you choose to start another squeeze test prior to a 1-minute waiting period, the system requires at least 20 seconds before you can enter the catheter position to restart. You'll notice that when the counter is at 40 seconds, you'll be able to enter the catheter position, and then 5 seconds later, the initialization reading will appear to do the Run position again. The timer indicates that the patient has now rested for 30 seconds. Tap the Location button of the catheter again. This takes the initial reading for 5 seconds. The Run button will activate again, and another test can be initiated. Again, instruct the patient to sustain their squeeze for the full 20-second period. It's important to note that if something occurs during the squeeze test, such as the patient coughs, this may be entered in notations and will be attached to that test. The notes function can be found down in the lower corner of the screen. In this example, we will enter that the patient coughed during the test, and that will now be recorded in the history of her test. Tap OK to confirm. Notes can be added to any of the 6 tests at any time to assist in remembering specifics about each test conducted. A third test is conducted in the same manner. The catheter position is entered, confirming that you are still in position 0. A 5-second initialization will occur. Then tap the Run Test button. Again, instruct the patient to squeeze and hold it for the full 20 seconds. As they squeeze, measurements of the anal canal pressures are taken in 4 locations. After the 20 seconds is completed, instruct the patient to relax and rest. You can perform as many as 5 of these tests. Most clinicians do 1 to 3. When completed, tap the Next Test button and you will proceed to the next test, called the Expel Empty test. This test entails instructing the patient to simulate trying to expel a bowel movement. It's described as an Expel Empty test as it is done with an empty rectal balloon. The balloon is already primed with 10 cc's of air. That is considered the empty position. The test is started by first verifying that you are in the catheter position. If you haven't relocated the patient, it will still be at position 0. Enter the catheter position number. It will then take the 5-second initialization reading and confirm that the system is ready. Then simply tap the Run button. As the patient expels, you will be getting anal canal measurements as well as rectal pressures. It is also a 20-second test, and when completed, it will automatically go to the Expel Full test. The Expel Full test asks the patient to simulate expelling a bowel movement with a full rectal balloon. The industry standard is a volume of 50 cc's of air. At this time, turn the valve control on the 4-way stopcock so it's open to 3 channels and inflate 50 cc's of air into the rectal balloon. Once you've reached 50 cc's, turn the stopcock back and close it so it's only communicating between the manometer fob and the catheter. To begin the test, instruct the patient to bear down, as if they're defecating. Tap the catheter position, as well as verifying that 50 cc's of air have inflated the balloon. If the patient feels too much pain at 50 cc's, you can reduce the air in the balloon to 30 cc's, although it's important to remember that this needs to be indicated on the up and down arrows. Once the balloon location is verified, it will display the size of the volume of the balloon as well as the diameter. It will do a 5-second initialization reading, and then the test will start when you tap the Run button. Again, this is another 20-second test. The data will display the patient simulating defecation with a full rectal balloon. You will be getting rectal balloon pressures along with the 4 anal canal pressures as the data is collected. At the end of the 20 seconds, it will advance to the next test. At this time, it is important to remove the 50 cc's of air from the balloon. Turn the stopcock to remove the 50 cc's of air, and then turn the stopcock back so it communicates only between the fob and the catheter. Remember to keep the 10 initial cc's of air in the rectal balloon. If there is no air in the balloon, proper pressure readings will not be attained during future tests. If you see that pressure readings are not being registered and you see mostly blue indications, stop the test. Inject 10 cc's of air to get an initial reading, and then the rectal balloon will once again be able to register pressures. The next test that's standard in the protocol is called the sensation test. The sensation test is going through the process of incrementally inflating the rectal balloon while the patient provides feedback as to the level at which they feel the sensation of simulated bowel. It starts out with sensation, which is when they feel a level of bowel. Then as the balloon inflates, it monitors desire to defecate. Then it moves to urgency, which is when the patient feels an urgent need to defecate. The last measurement is when the patient is experiencing pain. All 4 of these are used to generate a rectal compliance curve at the end of the study. it uses the previous test location. In our earlier example test, we used location 0, so it will automatically be located in this position. You will see that the run indicator is already on. You will also notice that up on the right side of the screen, the balloon inflation level can be seen. This is to monitor the inflation amount during the test, as the patient indicates the level of either sensation, desire, urgency, or pain. The test is started by tapping the Run button. As the test begins, the balloon is inflated with the 60 cc syringe by turning the stopcock. And as pressure increases, the balloon size is expanding. When the patient first notices a sensation, tap the sensation icon on the screen and enter the level of inflation. In this example, it would be at the 30 cc level. You will notice that the cc volume has put up 30 cc's, and also at this location, you will notice the size of the balloon is indicated. Now inflate the balloon until the patient gives you the sensation of desire. Now the balloon has increased inflation. The patient will state that they have the desire to defecate. Tap the desire icon and enter the inflation level, in this case 50 cc's. As testing continues, the next measurement is urgency. It's important to remember that at any time, if you need to reinflate the 60 cc syringe with air, turn the stopcock indicator so it shuts off that port. You can then take the syringe off, reload with air, and attach to add more. As you increase the level of inflation, the patient will begin to sense the level of urgency, that they have to go at this point. Tap the urgency button and enter the amount of air at that moment. In this case, it would be 70 cc's of air. Enter the amount and verify. Continue to carefully inflate until the patient registers the sensation of pain. Once you get to that location, enter the level of inflation. In this example, it would be 100 cc's of air. Tap Enter. At this time, the test is completed. It is important that you remove the pressure that you put in. If you put in a total of 100 cc's of air, you would need to remove 100 cc's of air. It is very important to maintain the initial priming of 10 cc's of air. Going forward in testing, if you notice that you are not getting a rectal balloon reading, stop the test. Increase the pressure of the rectal balloon with 10 cc's of air and resume testing. The last of the 6 standard protocol tests is called the exhale test. And the exhale test is asking the patient to expel a simulated bowel movement while blowing into a party balloon. You may ask the patient to simply exhale their breath, or the patient could simulate a cough. But the best results can be achieved with exhalation into a party balloon. Once again, verify the location of the catheter. If the position has not changed, tap Enter, and then tap the Run Test button. This is a standard 20-second test where you will get the rectal pressures as well as the 4 anal canal pressures. The test will proceed until its completion, at which point it will automatically go to the final phase, the review screen. This screen will generate every test that you have completed. The tests are arranged in the order in which they were conducted. This test is done in a graphic with colors. There is a symbol down at the bottom that shows you what the pressures are in millimeters of mercury. Again, you can add notes at any point in time. You can also change to a line chart at any point. And you will see the same information in a different presentation. You can go back to a bar chart by tapping that icon. If you choose to zoom a particular area of the test, all you have to do is use the pointer pen, touch the screen, and drag it up to a location, and it will zoom to that particular screen to give you more detail. And you can continue to do that to get very high-resolution detail if you choose to. This screen depicts 15 seconds of the actual squeeze test. To return back to a non-zoom screen, the pointer pen has a button. Press, click, and then tap the screen. The unzoom icon will take you back to the original screen. This works both in the line chart screen as well as with the bar chart screen.